Oh, goodness. What happened here?
There we go.
Looks good. All right, sir.
All right.
Heat-related illness. Everybody, I'd like you to meet Dr. Matthew Eschelbach. He is our co-medical director from Redmond, Oregon. And he, as he has on his screen, is medical director of EMS and trauma at St. Charles Medical Center, as well as a co-medical director for PERCOM. He has been lecturing for us now for, oh, geez, almost a year, right, Dr. Eschelbach?
Yeah, just about a year.
Yep, and we always enjoy your lectures, sir, so I am turning this over to you now.
All right. Well, I was looking at my list here, and we had done hypothermia last September in preparation for the winter. And so tonight we're going to talk about hyperthermia and heat-related illness. So we'll get started.
Going to be okay.
Clippers. No.
Oops, sorry. Sorry.
Can you hear me? You're going to be okay.
Clippers. No. No, Clippers. Oh, Doc. I think Grand Hana was really bugging me.
Here. Clear her nose. It's all blocked up.
Pad.
Paddles.
Prescription pad. Emergency departments are for one thing only. Emergencies.
Okay. All right, we'll get started. So heat-related illness is a true emergency, and it comes in several forms, some very simple and some life-threatening. Information from the CDC is a little bit older, but still relatively up to date. So between 1999 and 2003, there were about 3,500 heat-related fatalities in the United States. On average, there's about 690 deaths per year, and the largest fall into two categories, males and the elderly. Take a look at what is interesting. If you can follow here, you'll see that there's an incline with age, and these seem to be related to work and working. And then when you get to over 65, males and females are very, very similar, and we'll talk about that at the end as to why that can happen. But the majority of these males are a much higher risk than females, and that just has to do with my belief of the Y chromosome, that women are smarter than men. So we're going to talk about a few things, how the heat is regulated inside the body, causes of heat illness, a couple of clinical pictures, pretty easy treatment algorithms, prognosis, and prevention. So the body likes to run at pretty much normal temperature of 98.6. That's an average temperature, and most of us function best at 98.6. When we get ill, what does our body do? Our body raises temperature to try and kill whatever is trying to make us sick. So as temperature increases, metabolic rates go up, and cell damage can also happen. This is an interesting slide that shows what happens with heat disorders as temperature and humidity go up. So you'll see to the right, it takes an awful lot of temperature at low humidity to make somebody ill. And as the humidity goes up, it doesn't take as much at all. So in these brown zones, we get more of the typical possible fatigue, which we'll talk about. In the darker melon colored there, we get into the sunstroke, heat cramps. In the darker orange area, we can get sunstroke and heat cramps and heat exhaustion. We'll go over heat exhaustion towards the end. And then the most deadly of which is heat stroke, is towards this darker brown area here. So you can see as the humidity goes up, that comes on a whole lot sooner as far as temperature goes. So there are 5 simple heat-related illnesses. Some of these are combined. Sometimes you have 1 and 3, or 2 and 4, or 1, 2, 3, and then 4. But what you really want to avoid is number 5, heat stroke, because that is the most deadly. And we'll go over each one of these in a pretty simple fashion. So we'll talk about normal body temperature regulation. So as you gain heat, your metabolic rate increases, and usually you can also gain heat from environmental aspects. So as we just talked about, as the temperature and humidity go up, so does the heat gain of the body. Heat loss, we talked about heat loss when we talked about hypothermia, and it came from the same 4 aspects: radiation, convection, conduction, and evaporation. Conduction is the transfer of heat by direct contact down a temperature gradient. Convection is a transfer of heat by movement of heated material like the wind. Radiation is a loss of heat from non-insulated areas like when you're sweating and you have an open t-shirt. And respiration is your water evaporation, and that's lost through exhalation and increased respiration. Physiologically, heat dispensation is mostly radiation, a gradient between the environment and the exposed body area. Conduction is about 2 to 3% direct contact with a cold substance or surface. Convection from wind is 10 to 15%. This is also a very, very good area for us to become dehydrated, because as we sweat more and we convect more and we don't take water in, this can be a disastrous effect. And evaporation is about 20 to 35%. So we showed you this little guy before, heat loss for hypothermia, and it's the same relative science behind hyperthermia. You conduct to the rock surface here, or the wind can come by and convect you. Evaporation is through your wetness and losing heat that way, and your radiation is that which you go off. Respiration and evaporation go together, and radiation is the heat that you give off to the environment. In a military sense, this is because, remember, we learn the majority of our information about illnesses and trauma from the military. This guy here shows us what's going on here. The conduction is into the ground, and the ground thermal radiation is giving back some heat. You've got some metabolic heat from the muscles. You've got work, and metabolic work will cause increase in temperature. You're convecting and radiating at the same time. You are evaporating and sweating, and you're evaporating through respiration. Keep in mind, the solar radiation is going to continue to beat down on you. The sky thermal radiation is going to continue to beat down on you, and air temperature and humidity will also affect that, which we already talked about. During the first Gulf War, that was way back in 1991, most of you were probably either not born or just children, but we shipped troops over to the desert outside of Kuwait, And they actually sat there for almost 6 weeks trying to get these folks accustomed to these forces. So this is something that the military takes seriously, and they have learned a great deal about. Contributing factors, these are the things that can also add to the worsening of heat-related illness. If you had previous heat injury, you're more susceptible to have it again. Alcohol consumption. Alcohol is something that dehydrates you, and you lose some of your thermoregulatory aspects of your physiology with alcohol consumption. The use of dietary supplements, and this can be simple things like diet pills or Sudafed, or a number of people take other dietary supplements such as Adderall or ADD medication. Fatigue, obviously, you know, the hotter it is and the more you work, you get more fatigued, and these will contribute to heat injury. And the skin itself, if you don't protect it, we can wind up with sunburn. Sunburn decreases the amount of evaporation and increases the heat mass of the body. There are 3 major ways to prevent heat injuries. Number 1, proper hydration, which we do all the time. If we are hydrating properly, people are much, much better with this than they used to. We have less heat-related illness. I'm going to talk about this wet bulb monitoring a little bit, because this is something that most of us don't do, but if you've ever run a race in the summertime or wondered why you have to start a marathon at 6:30 in the morning on a July morning, it has to do with this wet bulb monitoring. We'll talk about that. And then acclimatization is what I talked to you about with the Gulf War. Every time we go to a foreign land and wind up in a conflict, we have to acclimatize, and the acclimatization takes a process of 4 to 6 weeks. So proper training and awareness of heat risk will minimize heat-related injury and fatality. So wet bulb monitoring. The wet bulb index is a good indicator of external heat stress on the body. It determines race conditions and military training. I'll show you a few pictures of that in a few minutes, but in the morning, 15 minutes before a race, the race director will take out the wet bulb, hold it up, and determine whether or not, depending on the length of the race and the average time of the race can go on. And military trainers will also use a wet bulb during military training so that they don't cause injury. It works by incorporating the effects of air velocity and humidity. That's the wet bulb part, and the air temperature and radiant heat, and that's the globe temperature. So this is what they look like, and they're simple instruments, and they're held up, and the bulb itself determines what the radiating heat is. The bulb will also determine the velocity and how much wind will be evaporating and what the risk of heat illness could be. There are races that sometimes have had to be canceled because the wet bulb has determined that they can't have a race safely. Most of the time, race directors schedule these events early in the morning so that the wet bulb has a good chance of things succeeding. So heat illness standard and high heat procedures. What happens is at about 95 degrees Fahrenheit, you can get heat illness triggered. Very often what they're talking about in this slide is determining, some of these slides not only come from the military, but some of them come from aspects of folks who work out in the heat, such as the folks who work out all summer, laying down tar or putting up roofs or something to that effect, when they got high beating heat and they have to work for long periods of time in the sun. So we'll have a pre-shift meeting to review high heat procedures. They'll put out observation signs and they'll look for signs and symptoms in their employees. They'll have mandatory 10-minute cool down and recovery for each 2 hours of work. And this is a good standard and built into OSHA rules as well. And employees must be authorized and able to call for emergency service or some kind of designated on-site employee if they need help with heat. It also includes the definition of training in a written plan. It applies to new employees and heat wave events. Very often you'll see that during the hottest parts of the summer, they'll suspend work for a few hours and move work to a different area or do something else. Also, if you're returning from work after an extended absence, you're going to have to acclimate all over again. New employees should be observed for the first 14 days. And during a heat wave, everyone should be observed. And higher risk persons observed specifically. And then eventually you get a gradual increase in work over a multi-day period. So you'll probably have shorter shifts at the beginning of the week, and as time goes by, those can be increased as you acclimate. What are some of the predisposing factors to heat illness? Well, first off is physical activity, and that's obvious. You're working in the sun, exercising, digging a hole, etc. Extremes of age or poor physical condition. People who are taking multiple medications, for example, we'll talk about those in a few minutes. Excessive clothing, dehydration, cardiovascular disease, skin disorders, obesity, and drugs. Now, keep in mind that these drugs are the ones that are listed here: calcium and beta blockers, diuretics, amphetamines. Now, amphetamines can be something as simple as your regular medication. If you had ADD, for example, a lot of people are on Adderall, and that is a form of amphetamine. LSD, cocaine, and monoamine oxidase inhibitors. We don't see those very much anymore, but they can also cause this. And keep in mind, excessive clothing. I put this down because most people in a hot environment don't wear excessive clothing. But those folks with mental illness and sometimes the homeless, everything they have is either in a shopping cart or in a bag or on their back. And these are the people that you really have to watch out for. They could be crazy from underlying mental disorder. They could have signs of dehydration and heat injury, or they might be on drugs that are making things worse. One of the things that I talk about when we talk about the uncontrollable patients who have taken maybe LSD and cocaine and methamphetamine, they can have a crisis by having excess heat, and that is very deadly to them. Drugs that interfere with thermal regulation are those that produce increased heat. A lot of older folks are on thyroid hormone. Amphetamines, again, tricyclic antidepressants, and LSD. Certain medications will decrease the thirst, like Haldol, and some will actually decrease sweating, like antihistamines, anticholinergics, phenothiazines. These are the ones that people use for nausea. Benzotropine, these are all possibilities of drugs that interfere with thermoregulation. All right, mild injury. These are what we call the canaries in the coal mines. Canaries in the coal mine comes from the concept of when they had coal miners. One of the first killers of coal miners in coal mines would be carbon monoxide gas. And they actually used to carry canaries in a cage down into the coal mines. If the canaries died, they knew it was time to get out of the coal mine. So the canaries in the coal mine are the people who have symptoms of mild injury. And these can be dizziness, headache, nausea, unsteady walk, weakness, muscle cramps, and I'll go over those in a few minutes. And most of the time, these folks just need rest, water, and evaluation. Very often, you guys will get hired to earn a little extra money when you're in school, to serve as a volunteer, perhaps, or you might get paid to be on a shift if somebody is doing a summer race or a summer walk for charity or something to that effect. And very often you have all kinds of comers, people who are very fit, and then those who are elderly, and you'll find that those folks are the ones that are going to start suffering first. When you start seeing this early on, these are the ones that make you kind of raise the hackles and say, well, somebody else is coming up next. So you have to be careful and make sure you hydrate the folks. Prickly heat is a very, very common heat rash. It's usually in exposed areas. It has these little red raised bumps. It usually goes away quickly as the temperature goes down or people get out of the sun, and it can be very infuriating to people who suffer from it. Heat rash, the signs and symptoms are clusters of red bumps on the skin. They often appear on the neck, chest folds, or folds of the skin, and they're a problem in hot work environments. Essentially, the treatment is to work in a cooler, less humid environment when possible, and try and keep the affected area dry. When it comes, I'm going to go back one. When it comes, cool water in a cool environment will usually calm this down. It comes usually all at once, and it's pretty distressing to feel and see. Heat cramps are a little bit different. These are muscle spasms. We've all had a cramp in our muscle, like maybe, I don't know, late at night, either lying in bed or what we call a Charlie horse, which is a muscle spasm. It's associated with pain, but heat cramps are usually in the abdomen, arms, or legs, and it could be the very first sign of worsening heat-related illness. Very often, if you're running the race, or you'll see this on football players, usually in games at the end of the season or at the beginning of the season when it's very, very hot on the field, and all of these football players are being told to drink and hydrate, and they're running and running, and they still get electrolyte abnormalities, and they have to stretch, and you'll see that they can get cramps in their abdomen, arms, and legs. Usually it's improved by just rest in a cool area. Drink water or other cool beverages. I would recommend Gatorade or electrolyte replacement drinks. Wait a few hours before you're allowing to return to strenuous work, and seek medical attention if they don't go away. This is something that every year I have to kind of give special permission to a few of my agencies to be able to start an IV, treat somebody, and not transport them to the hospital. Very often, in a number of my agencies, they'll have these long races, and the medical directors of the race will ask the local EMS agencies if they wouldn't mind being standby. And at the end of the race, some of these people are having spasms and nausea. And my rule has been, if you can cure this with, if they're after 1 liter of IV fluid, if they're taking oral fluids, no longer having any symptoms, no longer having nausea, vomiting, then they can probably be discharged at the scene. Otherwise, they need to be transported to the hospital. But that's a special circumstance, and it usually only happens during a few races during the summer. Heat cramp is usually caused by total body salt depletion. When you sweat mostly sodium chloride. It does not involve the entire muscle, usually sections of muscle or only one area, like the upper part of a calf muscle, the lower part of the calf muscle. The cramps appear to wander, and these are mostly in the non-acclimatized individuals. Treatment is usually just simple 0.1% solution like Gatorade or Propel, and then a half to 1 liter of normal saline. And as I said before, my rule is with these race individuals, if they get better and they can take oral and they're no longer having symptoms after 1 liter of IV fluids, they don't necessarily have to be transported to the emergency department.
Okay, I lied about the traffic. These dudes aren't totally mental. Just getting big air is dangerous enough. That's why they picked a mountain road nobody ever drives on, except during ski season.
All right, distraction. All right, let's talk a little bit about, we've talked about prickly heat, muscle cramps. Now we're going to talk about heat exhaustion. If you take a look at the picture on the left, I was in Palm Springs about 2 years ago and went to the tennis tournament down there. And I was sitting there, and it was probably about 100 degrees inside the stadium. And I'm watching these poor tennis players who are sitting on this hot, fully exposed area, and they can also suffer from this. Or as I showed before, here's somebody in a summer race. When I was in Hawaii a couple Octobers ago, my hotel was directly across from where the transition point of the Ironman triathlon is. And these people are going 8 hours. So, you know, most tennis matches will last under 2 hours, but 8 hours in the heat or a marathon, close to 3 hours in the heat, can be devastating. Heat exhaustion is just a complete inability to continue the activity. So put this in your mind. These people just can't go on any further. They have nausea, vomiting, irritability. Very often they'll have a headache because as they become dehydrated, the brain will shift in its fluids and can cause a headache. Orthostatic changes or syncope, they might pass out. They have weakness or shortness of breath. Piloerection is a very fancy word for goosebumps, and very often diffuse sweating. So I'll talk about these two things a little bit later, but diffuse sweating is a good sign, believe it or not, because as you cross over from heat exhaustion to heat stroke, you kind of lose your ability to sweat and you lose your thermal regulation. And that's why heat stroke is so devastatingly terrible as a disease. You get impaired mental function. You just don't make the same good decisions. Some people will continue on even though you know, they're vomiting and nauseous. They'll say, I'm fine. And the core temperature can go up to about 102 degrees. And core temperature is the way to do this. And really, under the arm or in the mouth is not the best because these people are going to be a little bit dehydrated. The best way to take a temperature is rectally in these folks. The treatment is pretty easy. Rest, active cooling, which I'll go over in a few minutes, external evaporation treatment, which I'll go over also, and about 1.5 liters and 2 grams of sodium chloride per hour. So you actually have to pour the fluids into these folks so they don't wind up with severe dehydration and their kidneys can get in a problem. So when we see these people in the emergency department, they're usually hyperthermic, and we cool them down with these active cooling and rapid external evaporation. And then we just pour the fluids on, and we usually give them fluids until such time as they're urinating. Whatever's going in is coming out. Like a 4-hour race, for example, you can lose up to 6 liters of water. So rapid cooling just like, again, they show in this military garb, cover as much of the exposed skin as possible with cold, icy sheets, and, cover somebody with, what I would do is remove all this extraneous clothing and get them down to their skivvies, and then cover them with a sheet, and then just take water out of the cooler and then quickly cool them down as quickly as possible. Cover the top of their head, and when the sheet warms up, put them back into a cooler and then reapply more cold water. The other thing that you're going to do is convect. So if you've got a fan, blow a fan on these people as much as possible, and try and cool them off so they're going to have that evaporation heat loss and the radiation heat loss, the transfer heat loss that's going from the hot body to the cold sheets, and you want to decrease that internal temperature. When that internal temperature continues to go up and you lose thermoregulation, that's when you run into the next deadly disease, which is the heat stroke. And this is the killer. This is the one where almost the point of no return. Classic risk groups for classic heat stroke are the elderly. Remember our very first slide when I showed you heat-related illnesses, and 65 and over, males and females, were nearly identical. Those people with chronic medical problems such as congestive heart failure, obesity, alcoholism, diabetes are also susceptible. Small children in closed vehicles, we see this every summer, every year. It's not just small children, but also pets. What they do in our area, we're in a high desert area where it can go up to 100 degrees during the day and down to 40 degrees at night. But what happens if you park a vehicle in one of our parking lots and there's a child inside or a dog inside, people will smash the windows to get the kid out. And every year on the news, there's something about a small child who has died because the father or mother forgot to take them out or thought it they'd only be a minute. And then there's all kinds of tragic stories, which we don't need to go over. Athletes, military recruits, construction workers on a hot, humid day, these are all high-risk groups for exertional heat stroke. What happens in heat stroke that's different than heat exhaustion is total thermoregulatory failure. So you get temperatures of 103 to 105 Fahrenheit, 39.4 to 40.6 centigrade. You get bone dry, hot red skin. At this point, remember I said heat exhaustion or just muscle cramps, you're sweating profusely, and that's a good sign. When you get bone dry, red hot skin, that's a bad sign. That means that you're heading towards thermoregulatory failure. You can get vomiting, diarrhea. People can go into a coma or have impaired mental function or seizures. At least once or twice a summer during a heat spell, an older lady and older gentleman who lives alone will be brought in a comatose state, and we'll find their temperature up around 105. We'll treat them as a septic patient, suspecting some type of infectious disease, and sometimes just hydration will bring them back around and getting their temperature down. The brain, like I said in the very first slide, likes to live at 98.6. So as the temperature goes up, the brain becomes less efficient, and you can have abnormal brain function. People can become confused, combative, just like they would if they had a low blood sugar, for example. Or they could pass out and then, in the worst case scenario, lead to sudden death. This sudden death is what happens very often when we have an agitated delirium patient. Agitated delirium is something for another day, but people who use, remember we talked about drugs, methamphetamine, heroin, tricyclic antidepressants, also, LSD. People or cocaine can be unreasonable, and the excited delirium, the more excited they get, the more crazy they get, and their temperature goes up. These are the people who get tased because they're a threat, and then can suddenly die in the back of a police car, not from the taser, but from the drugs that are on board. The differential diagnosis, you should also keep that in mind. What else could be causing this? Malignant hyperthermia can happen. Usually only see this when we have depolarizing muscle relaxants. That's probably the only time that you would see it. That's succinylcholine. So if you give succinylcholine to somebody and their temperature shoots up, that can be malignant hyperthermia. Halogenated anesthetics are something that they see in the operating room. And there is a cure for this, dantrolene, but it's a very, very quick and sudden increase in temperature, and it's a crisis in the operating room. Febrile seizures, especially central nervous system infections. Strokes can have increased temperature or behave like a heat stroke. Neuroleptic, malignant syndrome, and seizure. And drug overdoses like cocaine, amphetamine, MDMA, MDEA. These are all things that can, bath salts can cause heat stroke-like symptoms. So it's a simple algorithm that you follow. Does the patient have significant involvement? Are they mentally off? Ataxia means they're not moving their extremities well. Are they in a coma? Are they confused, irritable, or seizure? If the answer is no, it could be simple heat exhaustion. Hydrate, remove from the heat source. Did they resolve in 20 to 30 minutes? No, then activate heat stroke algorithm. And if it's yes, education and heat-related illness. Most of these folks, I said, as I showed you, if they get better in 1 liter or so, they can go home. Over here, heat stroke, ABCs, initiate EMS, remove patient from the heat, begin cooling if feasible, and then management in a medical facility. These people who are on the heat stroke side need to be seen, and I'll talk a little bit about that. You want to get their temperature down, so we pour on the sheets and we get these huge fans going on them, and we get a rectal probe in them so we know what their rectal temperature is. We do laboratory tests because we want to make sure that, number one, they don't have an infection or something else causing this. We want to take a look at their renal function. This is very, very important, this renal function. People will start to have kidney failure, and as they have kidney failure, they get breakdown of muscle, which clogs the kidneys even more, and you have to warn the patient about re-exposure. Treatment, sometimes you have to intubate them. If they're comatose, just like a trauma victim, if they have a GCS of less than 8, it's probably best to have somebody else control their airway so that if they continue to vomit, they don't aspirate. Sometimes we'll have to do this total body immersion and cooling. Most of the time we get out a sunrise blanket and we start to cool them just like we would if somebody who had, if we were reducing hypothermia in somebody who had loss of function of their cardiac, and we are trying to cool them down to put them in a coma. About 0.5 centigrade per minute to get them down to 37.8 degrees. Rectal temperatures, usually we pour in the fluids. You have to be careful with some of the older folks. If you pour fluids in, they can wind up with congestive heart failure. And then you're going to have to monitor the coagulation and acid-base balance in the emergency department. So these are the people, as I said, if you suspect heat stroke, they need to be in a hospital. Pre-hospital care, cooling is the first priority. You know, you can reduce mortality from 50% to 5% just by cooling off a patient, putting those sheets on them, stripping off the hot clothing, covering them with a blanket and wetting that blanket down, drenching them with water, put a fan on them, ice the sheets, massage the large muscles. If you have to put, you know, a bag of ice under their armpit and a bag of ice in their genital region, that's also possible. And if shivering begins, you can probably cool down, because then they've regained their thermoregulatory function if they're beginning to shiver again. These are some of the drugs that interfere. And as you take a look at these, keep in mind that these are common over-the-counter drugs like Benadryl. Atarax is for itching. Sudafed is a decongestant. Most of the time now, Sudafed is on a prescription, but high blood pressure medicines like diuretics, water pills, and beta blockers, and psychiatric drugs like tricyclic antidepressants and antipsychotic medications like Haldol can actually interfere with the thermoregulation. And we already talked about that. This is probably why so many of those homeless or street people who have underlying psychiatric disorders, you sit there and you wonder how in the world can they be wearing 3 coats when it's 90 degrees out and all you want to do is, you know, take your shirt off. So in summary, to prevent heat-related illness, stay indoors or in the shade if possible. Drink plenty of fluids. Rest and minimize strenuous activities in the sun. The young and the elderly are the most susceptible to the heat-related illness, and they're going to require increased monitoring during extreme conditions.
Meep, meep. Meep, meep.
So that's a Russian base jumper, and believe it or not, they survived. So, questions?
Mine is, where in the world did you find that video?
I collect idiots, Jane. That's
I don't know if you should say that out loud. Seth, Tiffany, do you have anything you'd like to ask Dr. Eschelbach?
No, it was very interesting.
All right.
Seth, you still there? Seth?
I'm still here. Sorry, I was using the chat.
Do you have any questions for Dr. Eschelbach?
No, ma'am. That lecture was very clear and easy to follow.
All righty. All right, Dr. Eschelbach, do you have anything else tonight? This one was short and sweet.
Oh, no. Thank you very much, guys.
Thank you very much, Doctor, for coming with us tonight. And I'll be posting this up for you guys or for anybody who's missed it, since tonight was a small night. Thank you. Talk to you soon.
All right. Take care.
Thank you.